Welcome and congratulations on your purchase of the Be Clear Targeted Photo Clearing System, combining the proven benefits of UV therapy with the latest advancements in targeted light technology. Psoriasis and other skin problems can be an annoying inconvenience, or they can damage a person's self-esteem and affect quality of life. Your community will benefit greatly from your decision to make available this breakthrough treatment. The Be Clear Targeted Photo Clearing System delivers highly concentrated therapeutic ultraviolet B light for the medical treatment of psoriasis, vitiligo, and atopic dermatitis, and to reduce the symptoms of many inflammatory skin diseases. This presentation is provided as a general guide to familiarize you and your staff with the Be Clear system. In it, we will describe the system's components, its operation, and review basic psoriasis and vitiligo treatment guidelines. Your Be Clear system includes the following components: console, touchscreen display. The touchscreen display is the way you'll interface with the system. Light source. Easily removable door provides access for replacing the light source. Fiber optic cable. Light is transmitted from the console to the handpiece via the fiber optic cable. Handpiece. You'll use the handpiece to deliver UVB treatment. The handpiece contains delicate optical components which may be damaged if dropped. Calibration storage port. To calibrate the unit, the phototherapy system is fired at an energy meter located directly below the handpiece storage port. Foot switch. Use the foot switch to activate the emission of UV light. For safety, the foot switch is entirely pneumatic, operating with air pressure rather than electricity. Emergency stop switch. The system can be shut down immediately by pushing the emergency stop button. Key switch. When the main power is on, the key switch is used to activate and deactivate the system. Cooling perforations. Be careful never to block or cover the cooling perforations when the system is running, as overheating can occur. Main power switch. The main power switch acts as both a circuit breaker to protect against excessive current and a switch to turn the unit on and off. Power cord socket. Remote interlock converter socket. You can configure your system for a remote action, such as halting operation whenever the treatment room door is opened. Contact customer support to set up a remote interlock switch. Foot switch socket. The foot switch socket accepts the pneumatic tube from the foot switch. The main power should be turned off whenever the Be Clear system will not be in use for more than 3 to 4 hours. Leaving the system on shortens the life of the light source. Make sure that everyone in the treatment area is wearing UVB protective eyewear. The treatment room door is closed, and the treatment room is otherwise safe for system operation. Gloves are recommended while operating or servicing the unit. Switch on the main power. The touchscreen will illuminate and display the system logo. The microprocessor performs a self-test that takes about a minute. Press Start on the startup screen. When prompted, rotate the key switch to the on position. The system takes about 5 minutes to warm up. The calibration screen will appear. A calibration check is required each time the power is switched on and should also be performed prior to each new patient. For accurate calibration, the handpiece tip and energy meter window must be clean and free of moisture and debris. The calibration screen will guide you through calibration. Lift the handpiece from the calibration storage port. Reinsert the handpiece. Switch the system to Ready mode. When the foot switch icon appears on your touchscreen, step on the foot switch and keep it pressed during calibration. Calibration progress is displayed on the touchscreen. Release the foot switch when calibration is complete. If your system measures an abnormal reading, recommendations will be given as to possible fixes on the touchscreen display. Often the problem is caused by dirt or moisture on the tip of the handpiece or calibration window. Calibrating your system between patients follows a slightly different procedure. Select Ready from the treatment screen. Step on the foot switch and keep it pressed during calibration. Calibration progress is displayed on the touch screen. Release the foot switch when calibration is complete. The treatment screen provides system information and is where you'll set treatment parameters. Set the desired fluence using the arrows next to the fluence indicator. Standard fluence range is between 50 to 800 millijoules per centimeter squared. There are two system status modes, Standby and Ready. In the Standby mode, the system is ready for use but has not been activated. When in the Ready mode, the system is ready and will emit light whenever the foot switch is pressed. Adjusting any parameter, or if the system is not used for approximately 3 minutes, will cause the system to automatically return to Standby mode. This feature prevents unintended emission of light. Your BeClear system can operate in either single or continuous treatment modes. In the single treatment mode, the system will deliver the prescribed fluence in a single emission each time the foot switch is pressed. In continuous treatment mode, the system will continuously emit light as long as the foot switch is pressed, delivering the prescribed fluence at a consistent, pre-described rate. Audible beeps provide a cue for moving the handpiece. Use the Mode button to select single or continuous treatment modes. From the Options screen, adjustments can be made to pulse duration. This is also where you'll set the screen language. The factory default is English. The Minimum Pulse Duration button controls the amount of time it will take for the system to deliver the prescribed fluence. If the system cannot deliver the prescribed fluence within the selected pulse duration, it will automatically increase the pulse duration to an appropriate level. Petroleum jelly can enhance the transmission of UVB light through the skin and increases the ease in which the handpiece is glided over the surface of psoriatic lesions. Place your handpiece gently against the patient's skin. Don't press down. Some practitioners like to hold the handpiece close to but not touching the skin. Be sure the tip stays no further than ½ centimeter from the skin. A treatment mask can be used to protect normal skin. In the single treatment mode, the handpiece should not be removed from its location while the shutter is open. The shutter will open once, delivering the prescribed fluence each time the foot switch is pressed. In the continuous treatment mode, the handpiece should be moved over the target at a constant rate as indicated by the audible beeps. The shutter will remain open, delivering the prescribed fluence until the foot switch is released.
My name is Emil Tangeti. I'm a dermatologist in Sacramento, California. I operate the Center for Dermatology and Laser Surgery, and I'm also a clinical professor of dermatology at the University of California, Davis. I think the BeClear system offers us a unique opportunity to integrate a narrowband system into our office in a practical way for patients with mild to moderate psoriasis. An ideal candidate for the BeClear would be someone with mild to moderate psoriasis, that is psoriasis typically involving less than 20% of their body. If, on the other hand, there's more extensive involvement, we can often target those visible areas such as arms, legs, face, neck, areas that are very obvious, areas that cause the patient discomfort. But again, the ideal candidate would be someone with stable plaque psoriasis with mild to moderate psoriasis. A minimal erythema dose, or MED, is usually determined by placing 6 test spots on a protected area such as the buttocks or lower back. These are read at 24 hours and based upon the criteria, which typically would include pinkness involving a full square, we determine an MED. Once this is determined, we typically start treatments with anywhere from 2 to 5 times an MED. In my practice, we typically start with 3 times an MED. Treatment frequency is typically done anywhere from 1 to 3 times a week. Again, your results may vary. Some patients respond better to less frequent treatments, some more. After determining an MED, we often start with anywhere from 2 to 5 times an MED dose. This often depends upon the site we're treating. If we're treating an elbow, we often require more, typically in my practice, 3 to 5 times an MED. On the other hand, if we pick a more sensitive area, such as the unexposed part of the arm or leg, we're often using 2 to 3 times an MED. Again, pick the appropriate dose for the appropriate area. When the treatment requires more than 800 millijoules, we often have to treat this in 2 passes. I find it useful, for instance, if we're treating at 1200 millijoules, to give 2 equal doses of 600 millijoules. In treating psoriasis, we're often looking for some slight redness, but certainly not uncomfortable redness or blistering. If we have these or encounter these side effects, I think that we have to appropriately hold the treatment for at least 1 to 3 days, let this resolve. When it resolves, again, resume treatment, but at a lower dose. We should reduce anywhere from 15 to 30% depending upon the severity of the side effect and the response. But again, we shouldn't give up, we should continue and proceed on. If, on the other hand, we're treating the patient with vitiligo, we're looking for some slight pinkness, not a great deal of redness. The idea is to maintain stimulation of melanogenesis and not a burn. So again, we're looking for pinkness, and typically I'm treating my patient anywhere from 1 to 3 times a week. Often twice a week is where we get our best results.
To shut down your BeClear system, turn the key to the off position. Press the quit button that appears on your touchscreen display. Then watch the screen for your cue to turn off the main power. The handpiece tip can be cleaned with alcohol, Cavicide, or Virex. Apply cleaning solution to a clean gauze pad, soft cloth, or use an alcohol pad to wipe the handpiece tip. Use a separate piece of clean cloth to remove any residue left by the cleaning solution. You should wear gloves when cleaning the protective window above the energy meter, as fingerprints and smudges can affect calibration readings. Remove the calibration storage port insert. Apply non-abrasive glass cleaner to a clean cloth. Wipe the window. Then use a separate piece of clean cloth to remove any residue left by the cleaner. Reinstall the calibration storage port insert. Clean the touchscreen with a soft cloth and a small amount of non-abrasive glass cleaner. Gently wipe the surface of the screen. Use a separate cloth to remove residue. Should you encounter an error message, write down the code number so you can provide it to customer service. A list of error codes and recommended solutions is provided in your user's manual. The intensity of the light source decreases as the unit is used. Luminous recommends replacing the light source every 300 to 500 hours of operation, or when the desired maximum fluence is no longer available. Shut down the system before replacing the light source. Wait 20 minutes to allow the light source to cool. Put on gloves and safety glasses. Remove the exterior door. Grasp the handle on the light source assembly and carefully pull it out. Place the used light source on its side on a flat surface. The light source contains mercury vapor and should be handled carefully. Remove your new light source from its package and remove the plastic cover from the bottom of the assembly. Handle the light source by holding the housing only. Do not touch the light source directly. Slide the replacement light source into the system. Replace the light source door. Dispose of the used light source according to federal and local regulations governing hazardous waste disposal. The information provided in this video is intended only as a general guideline for basic operation. Consult experienced practitioners, current medical literature, and fully read and understand your user's manual before treating patients. Should you have questions, feel free to contact Luminous Customer Service.